Rhonda Sims, Program Director at Mama's Voices, Preeclampsia Foundation, as well as the founder of the Black Maternal Health Collective. The Black Maternal Health Collective is a unity of like-minded organizations who are focused on improving outcomes for maternal health. So we focus on women, babies, and families, ensuring that they are equipped with the tools and resources necessary for them to have positive birth outcomes. My story started prior to birthing my first son, and I was at the University of South Carolina as an advisor for Delta Sigma Theta. I came back and wanted to give back to the younger ladies that were still on campus. And I had this one young lady who I mentored. She was pregnant with twins, and she went in and birthed her babies. And unfortunately, she did not make it out alive. I dedicate my work to her each and every day, ensuring that her voice that is no longer existing in the physical realm is always heard on the side. So all of the work that we do in the community is in dedication to her. Preeclampsia is a heart condition, a cardio condition, and it's very dangerous when it comes to women who are pregnant. So when we think of high blood pressure in a typical person, we have certain numbers that we have to stay below. But when you become pregnant, it is dangerous because there is an influx of pressure on the heart as a pregnant woman. Preeclampsia is very dominant in women of color. So we come in maybe with preconditions, family history, things that we've dealt with prior to pregnancy, and it makes us at a disadvantage when we become pregnant. And we have those who teach classes on reproductive health and parental classes when it comes to educating our parents and our children on what reproductive health is, because we believe that we have to start younger than just at the maternal space, that it has to go back into primary education, teaching our kids about our bodies, our autonomy, and what it really does. Columbia Black Maternal Health Week, the first one was founded last year, April 2024, and our second Columbia Black Maternal Health Week is April the 5th through the 11th this year. And it is a week-long of events, just uplifting and educating and informing the community on why Black maternal health is so important. We know that Black women tend to die at higher rates than their counterparts, 3 times as more in fact. We realize also too, if you're in the state of South Carolina, that the March of Dimes released our maternity report, and we're still continuously falling into an F. And last year we were in F as well. So there is much work to do. And this year we're actually having a dad panel where we're bringing in men to come talk about their experiences with their partners as they birth. How do they advocate? What is their role when it comes for advocating and standing up for their birthing person? Since our first Black Maternal Health Week, it seems like it has gotten the wheels turning just in the state. I see that more people are talking about maternal health. It was not always in conversation. It was not always in the news. It was not always spoken about as a priority. So us meeting, just having a maternal task force is significant to the work that is in the future for South Carolina. Some of the things that I see that could be like future investments is really engaging community organizations and putting funding in those organizations. Our community organizations are working with limited resources, and many a times they're either suffering from the back end with providing for their own families to be able to support other families. But being able to invest into those organizations is going to be a phenomenal change for our state.